6 cases of the UK super spreader strain have been detected in India so far. Now, all 6 patients have recently returned from the UK, and these were cases that have spiraled within days. All patients have been kept in a single-room isolation in designated healthcare facilities by the state governments. Their close contacts will now have to be put under quarantine as well. Comprehensive contact tracing has been initiated for the co-travellers as well, where families and contacts and the others are being looked into as well. Now, why is this worrying? Because the new strain is believed to be at least 70% more infectious. But doctors say so far there is no reason yet to believe that it is not more, or it is perhaps more lethal, or will not be controlled by the vaccine. So far, nothing has been known. But does India at this point need to do more, or are we doing enough to try and contain what could be the next big super spreader event in the country? So far, around 33,000 passengers arrived from the UK between November 25th and December 23rd. That's the day the travel ban had been imposed. Now, of these over 33,000 passengers, 114 tested positive for COVID-19. Now, of these 114 UK positives, 6 have now confirmed of this mutant strain. So how exactly is India gearing up for it? I'm very delighted to have with us on the program today Dr. Rakesh Mishra. He's the director for the Center for Cellular and Molecular Biology. And that is the center that actually detected 3 of those strains over there. We're also joined by Professor Sanjeev Krishna. He's a professor for molecular parasitology and medicine, joining us from the UK. Thank you both for giving us your very precious time in times when all your time is very, very precious at the moment. Let me begin by asking Dr. Mishra. First up, Dr. Mishra, take our viewers through how exactly does this matching of the strain actually take place? We understand a genome surveillance is being carried out. If you could just explain to us, how did you exactly detect these strains in your labs?
Yeah, thank you. So the way this thing is done, when you collect a sample from a person, first check if the person is positive for the COVID infection, COVID-19. And if the person is positive, then we take it for the analyzing the genetic material of this virus in detail. And since the new variant, we know exactly what difference it has compared to the other variant which are going around. So if we read the sequence of this RNA, we'll be able to tell whether it is a UK variant or something else. So essentially it is to sequence the genetic material of this RNA, which can be done now easily. So the process is that you isolate the RNA, convert into DNA, and then put in the sequencing machine, and then read whether your read is like other strains or your read is like the variant that is in UK. So we find that some of the UK returnees do have the new variants, the UK variants.
Sure. Just for the benefit of our viewers, the genome is actually a genetic fingerprint of sorts. It is unique to every strain, and that's what is matched as well. Dr. Mishra, if you could also tell us, how long does it take to actually detect what strain these patients are carrying?
So it depends upon how you do it. If you do a quick method, which we have used, so you can do actually in a couple of days maximum. But then you can do only few numbers. So since we had smaller numbers, we can do that. But a good way of doing this is with high throughput way. So you can sequence hundreds of isolates in one go, and that will take then about 3 days or maybe a little bit more. And so, but you get large number of data. So now these are called next generation sequencing setups, which many laboratories in India have, which can generate sequence information, which then can be analyzed using computers, whether it matches UK strain or something else. Or we have our own new variants. So now India is planning to do surveillance in very large scale, so that if new variants are emerging, we'll be able to tell before they become a problem.
Right. Dr. Mishra, now that we've understood how exactly this is done, and you in your lab along with at least 6 or 7 others in the country are already doing it, would you be in a position to say, is it enough at this point? we are currently only looking at the genome sequencing of the positive passengers from UK. But what about other countries? There is enough evidence now that the UK strain did travel before we put the ban in place from other countries as well, countries which are still flying into India. So that is a major cause of concern. Is that an area the government needs to look at immediately now?
Yeah, I mean, government is aware of that, and discussions are going on to follow up at least 1 month old samples, I mean, positives, and see if how many of them, if any, have this new variants. And you are very right. This variant can come from, if people are coming through UK or somebody has gone to some other country and then got infected from there. And more important, remember that it emerged in UK sometime in September, which means people have been traveling without any issues till last week or 10 days before flights were banned. So my suspicion is this variant may already be around in many cities or places where people have come from UK a couple of months back or 3-4 weeks back, and they have been inadvertently spreading, because it is also asymptomatic most of the time, so people don't know that they are spreading the new variant or old variant. So see, that has been the key of this pandemic, that it spread so fast that before we react, things have reached quite far. So we have to have a consistent and long-term surveillance plan in place. For example, testing large number all over the country and sequencing a certain percent of them, of those who are positive, so we know which clade is emerging, which variant is emerging. And if something is picking up faster, then we know that is a super spreader or a more strong variant, and we can then take measures to stop that. So this surveillance process, which is in advanced planning stage in the country, and should, I mean, it requires resources, it is an expensive thing, it requires that kind of manpower, data handling, all those things. But I think things are getting in place, and we should be able to do it more efficiently and find out if there are new...
Dr. Mishra, stay on with us. I want to bring in Professor Sanjeev Krishna now. Sir, at this point, when you're just listening in from the top virologists here in the country to try and understand how India is tackling with the problem, UK has some problems of its own. We are talking to you at a time when UK has surpassed 40,000 cases. This is despite a lockdown, despite the vaccine there being in place. Could you take us through what's going on at the moment?
Thank you very much for the invitation to join you today. And I was very interested to hear what Dr. Mishra had to say, but I agree with you that we are in the middle here in the UK of what is going to be, I think, a tsunami of infections in the next 2 or 3 weeks. You asked about lockdowns and you asked about vaccines. Let me just mention vaccines first. This is going to be and is already becoming a very, very important weapon, I think, for the whole globe against this horrendous pandemic. One of the problems with this highly effective vaccine that's already being rolled out is obviously the length of time that it takes to get all the vulnerable people in and vaccinated, and that needs to ramp up very, very quickly. So we estimate that maybe you need to vaccinate up to about 2 million people a week if you want to get impacts through quickly. That will have a medium-term impact, or a near and medium-term impact. But right now, as you say, we've hit a record number of infections. And we have to remember that this, first of all, reflects what's been happening in the last few weeks. It's not something that's happening right now, because it takes a few weeks for the infections to present. And also that, the measures that have been taken up till now clearly have not been adequate. And we're now going into stricter lockdown measures. And all I wanted to do is to come back and emphasize that it is so important to stick to the basics when it comes to the control of this infection. So we need to observe social distancing. We need to use masks effectively. We need to do hand washing, and we need to do this quite rigorously. And if the social distancing involves keeping apart from any other groups, even family members, for the next few weeks, then so be it, because we need to restrict the increase in these infections. We need to bring down these numbers while the vaccine is being rolled out. And just to summarize, I mean, this is, if you like, a tension between infection and injection. And we want the injection to win. But in the meantime, the infections have to start coming down.
I like how you put that. Professor Krishna, I also have to ask you, then this sudden peak that is being observed in UK, is it directly linked to this new variant, the super spreader mutant of the virus? Is that it? Or are you saying this combined with the Thanksgiving weekend where people caught up and then Christmas, etc., is cumulatively giving you the spike in UK at the moment?
Well, that's a very interesting and important question. Let's put it this way. We know how this virus spreads. Okay, whether it's a super spreader, whether it's highly transmissible, whether it's the old variant, let's put that aside for the moment. We know how this virus spreads. It comes through close human contacts. It comes through spread through aerosols. It comes through spread in a way which is already understood. And therefore, we know how we should limit this spread. So I think you're right. I mean, I think there are variables that have not been controlled through the measures that have been put into place up till now. And unfortunately, when you put those leaky measures with an increased transmission of the virus, then you see what we are seeing at the moment.
Right. Let me bring in Dr. Mishra on this one. Dr. Mishra, some very important lessons perhaps then India has to learn from UK, and that's why I was very keen that we have both of you together to get an understanding of this as well. So at this point, when you hear Professor Krishna over there saying that vaccine immediately is not the only solution, is India doing enough to control this new variant at this point? Are we detecting enough? Do we have enough capacity also to try and contain it? Do we understand the level of problem we might be facing?
So I think we understand the problem we are facing, but I fully agree with first with Professor Krishna that vaccine actually is not the immediate measure. Vaccine, even if you vaccinate people, it will take 40-50 days before it will show any protection. So we cannot afford 50 days of a relaxed thing. So that is one, and that whether how long vaccine will protect is a different issue. But having said that, as you just heard, this virus is spread through people. It is not air, it's not water, it's not mosquito. It is people who are taking it from one place to other. So no matter whether what kind of a variant it is, we know how to stop it. So I will say that we have a certain healthcare system. We have limitations. So far, with bit of luck, we have been doing very well. But considering the mortality and recovery rates, there is
Why do you say bit of luck?
But say it again. Sorry.
Why do you say bit of luck?
Oh, the luck, because for some reason, large number of people are asymptomatic. We still don't understand why so many Indians are asymptomatic. Whether it's a prior exposure or whether we have a genetic structure, it's certainly not the virus. So that I consider is a major factor, because most of us get infection we don't even know. So that proportion is pretty high. Maybe we are a younger nation. Many things put in that. So now come back to the and compared to what we were testing in the April, May, what we are testing now is, I mean, there is no comparison. The tremendous increase, but the scale of this problem is such that it's never sufficient, I will say, particularly in terms of genome sequencing. We have been doing in the beginning, in the June, July, August, but after that, things started to become slowed down. I think that has to be, the government has realized that, and that is being put in place.
Consistent efforts to try and understand the new strains. That's what you're saying has to be made. Exactly. Then let me ask you this. Taking again a cue from what UK has done, they have a vaccine. They were one of the first in the world actually to get the vaccine. They also went into a lockdown pretty early, but that hasn't helped with them. Keeping that in mind, do you think it's time for India to put in more strict measures in place as well? I'm not talking about a lockdown, but at least when it comes to public gatherings during the New Year's, that's something that needs to be controlled, should immediately be on the focus of the government?
Absolutely. That is very, very important. See, in UK, vaccine will not work. As I said, it will take 40-50 days for vaccine to do anything. They just began last week. So vaccine is not a factor. whether people have taken it easy, and unfortunately this strong viral spreader came, and that's how they got into these kinds of problems. So we have to we have to do few things. One is, this is the UK strain, a new strain is coming. India is the second largest reservoir of this virus. We have more risk of generating variants which might be more infectious, less infectious, more dangerous, all those things. So we have to be extremely careful with that. To me, that is a bigger problem.
Right.
This we be able to, I don't think we can stop easily something from coming.
Right.
Something
Dr. Mishra, if I can just intervene there, because I'm running out of time, and just ask you this last question, which is very important. Of whatever you've studied of this new UK strain so far in India, what indications have you picked up so far? We know the ICMR said that there needs to be no change in the sort of treatment protocol, and the vaccines that we are considering right now will also be effective against the strain. Do you concur to that, or what's your observation?
Yeah, so the large number of studies indicate that Pfizer, Moderna vaccines are neutralizing the sera from those vaccinated people are neutralizing this virus. And our vaccines like Bharat Biotech or Oxford, these are likely to be more robust, but they can be tested. Again, now since this virus is there, we can look at if those vaccine sera are neutralizing these or not. So vaccine, as long as whatever all the indications are, it is likely to be as effective as against any other variant. And as I was mentioning, there is no really mortality difference or symptoms different. Otherwise, it's just that it infects more. Otherwise, this virus is the same as we don't notice any new mutations. What we have seen is all what is there in UK strain. So if we can prevent the spread, slow it down, we will be able to manage this.
All right, Dr. Mishra, Professor Krishna, thank you so much for joining us with the very latest and your views on this. We'll quickly slip into a break. On the other side, we'll also go across to the United States and get you a view on what's happening over there. The United States continues to be the worst impacted country in the world of COVID-19. Welcome back, and we have more important guests for you lined up on the program today. Dr. Peter Chitong, infectious disease specialist from University in California, joins us live. Now, thank you so much for taking our time and speaking with NDTV. Doc, I first just wanted to understand the situation in California at the moment, set to be the epicenter of the raging cases that are coming out in the United States. Take us through that.
Well, it's very dire in California right now. When you look at what we're looking at, it's kind of scary because we're looking at the capacity of the ICU beds. The fact that we're looking at that metric is very, chilling in itself. So we have 0% capacity in Southern California and 0% capacity of ICU beds in the Central Valley. In the northern part of the state, we're still at around 12% capacity, which doesn't give very much give in the system.
That's quite scary, 0% capacity over there. But what, according to you, has led to this surge? Is it Thanksgiving? Is it Christmas?
So there are three reasons why we're having a surge in California right now. The first is that it's colder, so there's less opportunity to gather outdoors. The second is that, there's pandemic fatigue, which some have recasted as pandemic resentment because everyone is very tired after being, pretty good for many months. And the third reason is that we can only be as good as our neighboring states. We have a huge population, so we were quite good in terms of numbers, but the surrounding states and the rest of the country was really surging. So that because of travel in the United States, that's the third reason. And, I would say that this is not even the Christmas surge yet. We expect a Christmas surge on top of this in about 2 weeks. So this is reflecting the Thanksgiving surge. So we're expecting a surge on top of a surge in about 2 weeks.
So the coming winter and January is going to be even worse now. But tell us, what exactly is the reason behind this? US again has the vaccine. How is it that it's not being controlled yet? We do understand that a vaccine also takes quite some time to actually show its effect on the ground.
So unfortunately, the vaccine, although really promising, and I think a lot of people are holding on to vaccine as hope, is not going to be the solution for the surge. It takes 28 days after the second dose of the vaccine, and the two currently approved vaccines in this country, they require 2 shots. So 28 days after the second shot is when you get the full immune response. It's not going to be here in time for all of the surge, and it's being rolled out very slowly. So only right now we're seeing healthcare workers and nursing home residents get it. I haven't even gotten my vaccine yet, and I'm taking care of COVID patients. To tell you that, we don't have enough vaccines for all the people. So we're just hoping what the vaccine would do, because we expect the surge to go on for some time, at least a month or more, is that it will keep our healthcare worker force relatively healthy from COVID. But there's no vaccine against burnout or mental fatigue, and that's what I'm worried about most.
Well, thank you, Doctor, for that. No magic wand over there. That's the only underlining thought after speaking with so many experts across the globe. So remember, always wear your mask and stay indoors as much as possible.